everyone. The following video for your medication experience through My Mandel's virtual learning experience is for human growth hormone. Human growth hormone will be possibly a part of your fertility cycle. Your clinic will determine for you based on your previous gynecological history, or if you've done any other cycles of fertility treatments, if this is a part of your cycle. It works in conjunction with some of the other medications that may be a part of your cycle. So it's not a one-size-fits-all that everyone does human growth hormone, but it absolutely could be a part of your cycle. So the purpose of this video is to help show you how to mix and administer human growth hormone. When you work with your fertility clinic, they will, of course, be working with a pharmacy like Mandel's that'll be shipping you the medication. Human growth hormone might come under another name, such as Omnitrope is another one of the names that you might see this in the packaging when you receive it. As always, there will be instructions on how to store the medication. Usually once you receive this medication, you can store it at room temperature. It is a mixing medication, so you'll find that I'll mention that once you mix the product, you'll have a little remaining of that mixture to use for a following injection, and that part of the mixture, we will remind you to put that in the refrigerator. So there will always be where you'll be guided how to mix, how to administer, and what dosage you're taking. All of that specifics comes from your clinic. This is just a nice general video to help you along once you do get that medication and you're ready to get started. What you'll find when you get the medication, the supplies you'll be needing are, usually you'll have 2 vials. One will contain a powder or a pellet in the bottom of that vial. The other vial that you'll have will have what looks like sterile water, just a water solution, but it is a sterile water solution. So these 2 vials are what you'll need in order to do your mixing. You may receive multiple vials from the pharmacy, and that's determined by your clinic. Depending upon how many days they project that you'll need the medication and your daily dosage, you will be ordered the amount of product that you need. And certainly if you ever need to get more, the clinic will advise you how to contact the pharmacy to potentially get a refill of that. So you need your powder vial and your water vial. As far as syringes go, what will be sent to you is you might have this 3 cc, 3 milliliter syringe sent to you, and it may have a longer needle on that. This is typically the mixing needle that you'll be using for the HGH or human growth hormone. The other needle and syringe that you might also receive may have an orange cap to it. These are typically referred to as insulin syringes because there's a very small measuring thin barrel syringe. And so what you'll find is you're taking a very small liquid amount of the medication. And so you'll need this type of syringe in order to inject. HGH is what we call subcutaneous injection. So the needle that you'll be using for injecting is going to be rather tiny, usually a ½ an inch in length. And the area of location will be confirmed to inject, but oftentimes at most clinics for this type of shot, you'll be using either the lower belly or possibly the upper top, upper side, outer thigh area. These areas have some nice fatty tissue, and that's the type of injection this is for absorption that works best with the medication. So your first step with any mixing and part of this mixing with your medication step is it's always a good idea to wash your hands. Working with the medication isn't sterile technique, but it certainly is a nice clean technique. So washing your hands before you do the mixing is a great way to get started. The next step is have available, and you might get these from the pharmacy. These are little alcohol pads, but you may also have a bottle of rubbing alcohol and a cotton ball that can be used to help administer when you put this into the skin, or also you'll see that I use it on top of the vial before I put the needle into the vial. So I'm taking one of these and opening it up. And my next step is going to be to uncap each of the vials, and I'll hear a little snap with that. And after I hear the little snap and I've taken the cap off, I'll just rub the top a little bit with alcohol. Just in case I did not wash my hands, it's a good idea you're cleaning the top of that vial. Even though usually it's sterile under the top, it's just a good extra measure to take to reassure that everything is good to go. The first syringe that we are going to use is that syringe that has the longer needle. Remember, for the HGH, this is a mixing needle, so I don't want you to worry about the size of that needle and syringe. So you open that up. Sometimes it's not a bad idea to just make sure that that needle is secured nicely, because it can come off that syringe, so you want to turn it and just make sure it's secured nicely onto the syringe. And we are typically going to be advised by the clinic how much liquid to draw up, but oftentimes with the HGH, what you'll be drawing up is 1 ml, 1 cc of liquid using this syringe. So I'll draw up to the 1 ml. So what I do with that is I'm drawing up an ml of air. I'm going to pull the cap off, take the vial that contains the water, the sterile water, and I'm just going to raise this so you can see me, but you could keep it on a nice flat surface. Put that needle in all the way through the rubber stopper, the center, turn it upside down, and you can inject a little bit of that air into the vial. If you forget this step, it's perfectly okay. I'm just equalizing any pressure in that vial by doing that little step. And then my next step is to just draw down. There may be some smaller bubbles there. That is perfectly okay. We are just mixing, we're not injecting. So right now, bubbles are not an issue for us. But we're going to draw down, lining up that black rim of the plunger to the 1 line. So 1 ml. I might have some extra solution in here. If our clinic tells us to only draw up 1 ml and there's extra, you don't need the extra. You can discard that vial. And then you take that 1 ml and you're going to put that into the vial that contains the powder solution. Let that powder dissolve. It may be very cloudy at first, might be even a little bubble in there. Again, you can keep the needle in there and gently roll. You'll see where mine's a little cloudy here, and that's okay, because it's mixing the liquid with that powder. So we let it do its mixing. After it does the mixing, we're going to remove that needle, because that was just our mixing needle. We can then put this into our red Sharps container. Oftentimes, like Mandel's Pharmacy, they will provide you with a Sharps container to keep all your biohazards in. That's anything that's sharp. So we can put that safely in the biohazard container. Now, this one vial, often with HGH, will contain 2 injections. So if you are given 4 vials of medication with 4 vials of water, then just to break that down mathematically, you have 8 injections. If you're given 5 vials, there's 10 injections. If you're given 3 vials, there's 6. Again, the dosages that you need for your cycle will be determined by your healthcare clinic, and they will be able to order for you what you need. So once this has been mixed, I'm now going to use the injection needle and syringe to draw up my dose with my clinic's help and my nurse and my doctor's guidance with my dosage. So for the sake of today's demonstration, what you'll see here is this syringe is measured in units, and there's 100 units in the capacity of this syringe. What I'm going to have you draw up today is 50 units. That may very well be a very similar dosage that you might have that we'll be advising you to take with your medications. So we have you uncap that needle. Here you don't have to draw up any air. It's perfectly okay with this little needle to just go in through that vial once, okay? And you're going to draw up and pull down to that number 50. And even though that might look like you're drawing up a lot of medication, I just want you to know that with this syringe, even though it looks like a lot, it really is not, because the needle, or I should say the syringe, is rather thin. So it's not a lot of liquid amount that you're taking. So I'm drawing up to the 50 units. If your clinic tells you to take 54 units or whatever that may be, they'll advise you specifically, but this is around the range that you might be advised to take. There will still be medication in this syringe, in this vial. So what you will do is, this is the vial that you would now put into the refrigerator. And then when you take this medication again tomorrow night, you wouldn't have to do the mixing step. You'd be able to simply use your orange tip needle to draw up. So one bottle usually will make 2 dosages of the HGH for you. And so really you're not mixing every night, which is a bonus, but you're mixing one night for 2 doses, and then you'll mix again another vial, because you will usually be on this medication for, an average of anywhere from 6 nights to maybe 8 nights. So that's why you're going to have anywhere between 3 to 4 vials of the Omnitrope or HGH medication. So once that liquid amount is in your insulin syringe, now you're ready to do the injection. I've capped the needle just to keep it safe so I can put this down for a minute, just to be able to show you guys where the injection areas are that you're going to use. I have a little mannequin here to just show us. It's easier for you guys to see that it's the lower belly below the belly button. And if you have your hip bones where you can feel that, in between those hip bones is where you want to keep the injection. And in this little area here, this is where we sometimes have a little fatty tissue that we're able to pinch. Upper abs tend to have some muscle there, so this is not a muscle shot. It only needs to be going into that area of fatty tissue. Your clinic may also advise you that you can use the thighs as another area. And so if you're using the thigh area, what we're focusing on here is upper thighs where there's not as much muscle, upper thigh area, and you could even use the side outer thigh area. So upper top thigh, upper side outer thigh, or belly. You can choose with this injection to be laying down and have somebody give you the shot. If they are administering the shot to you, the angle of the needle is going to go straight in. So if I were giving a shot to someone in their belly, I put the needle straight in this way. In the thigh, I go straight in this way if I'm at the top of the thigh. And if I'm doing the outer thigh, I go straight into their outer thigh this way. Okay, so it's a 90-degree angle, technically just straight in to make sure you get it into that fatty tissue. If you were to give yourself your own injection, you could sit as I am sitting in the chair, and the angle would be that I'm putting that needle straight into my belly. So I'd be giving the needle straight in this way into my belly. And if I'm doing my thighs are sitting, as this way with my belly up here. Once again, I'm going straight into the thigh and straight into that side outer thigh. The reason you just want that angle is just so you make sure that you get that into the area that you need to give that injection. One other thing that you do with this injection is because it's fatty tissue, you want to give a little pinch. So I kind of show my arm here just to see that this is my fatty tissue. So I gently want to lift the fat on the belly or the leg and lift it up. I don't have to squeeze very hard because you could bruise with that. So it's just a gentle lift. That's how you prepare the injection area, is a gentle lift. You've got the angle. These are the areas that you can select from, and then you determine who might be giving the shot, if you're having the shot given to you, or if you'd like to self-inject. Today, what I'll just demonstrate to make it a little easier for the video is that I'll show you if you were giving your own injection in the belly. So what we would do is we select the area of the belly first that we're going to give it into, and we clean that area with a little cotton ball doused in alcohol. Our next little step would be to pinch that area. So hopefully, I want to just turn it slightly for you to see this. If I pinch that area of fat, I'm giving a little gentle pinch. I would then uncap the needle. And with that little pinch, what I do is I place the needle gently to the skin, 90 degree. I put the needle in. This is where I might feel a little mosquito bite pinch. That's very natural and normal to feel that, but it's very gentle, that little teeny pinch. Once that needle is in the skin, I let go of the fat, and then I just simply push on the plunger, and I don't have to go too fast or too slow. I just go in a nice steady motion in, and then once all of that is into the body, in the skin, I then gently pull that needle straight in, straight out, put a little pressure there, and that will be where we just have a little droplet of blood, or what you might find is the medicine tries to make its way back out. So you want to keep it into the body there, so you just give it a nice little gentle pressure. Okay, and this would be your injection of the HGH. Once you are done with that syringe that you've just given a shot, you can leave the cap off and then put this gently right into your biohazard container to keep yourself and anyone in your family safe from any of those sharps. And as I noted, the vial that we did mix, we're going to put that in the fridge for tomorrow evening. Before we give the shot, we can take it out and set it down on the counter for about 5 minutes or so, just to let it warm up from that cold temperature. You can take it right out from the fridge, or you can let it warm up. Either way is fine. And then all you would need is one of those insulin syringes to draw up that dosage, because there'll be one dosage left, and then you'll administer the HGH. And it'll be that third night that you'll need to mix a new vial. So remember, you might be anywhere from 6 to 8 days of this, doing 1 injection daily. But again, the time of the dosage, the how much you will take, and the where you're going to inject, the clinic will also confirm this with you. But this video is a nice general way to see before you get started or while you're beginning your cycle with this medication, how that medication is mixed and administered. So we do hope here at the virtual learning experience with Mandel's PharmAssist program that this was a helpful video for you. And from all of us here at the virtual learning experience, we wish you all the very best with your fertility journey and your medication cycle.